you're a woman, have ever had sex, and are between 18 and 70, you should be getting a pap smear every 2 years, but it's often something we try to tend to postpone as much as possible. When should we start getting them? Well, anywhere between 18 and 20, or 1 or 2 years after becoming sexually active. But they're so uncomfortable and just plain weird. Do we really need to get them done? Really? Currently, pap smears are the best way of diagnosing cervical cancer. A doctor or a nurse will take some samples of cells from the cervix and they're smeared onto a glass slide. Once they're sent off to the lab, tests are performed and the results are available within a week. Sometimes you might be asked to provide another sample. Don't panic! It often means that the sample was too small or that the pathologists in the lab couldn't get a good look at your cells. Almost 1 in 10 pap smears come back as abnormal. Pap smears are for detecting abnormal cells. Often it'll be thrush or HPV. HPV? Isn't that cancer? Some of you might say. Well, HPV or human papillomavirus will affect around 75% of sexually active women. There are over 200 varieties of HPV, but only a very small number will actually cause cervical cancer. Most of the time, women won't even know they've got HPV. It usually clears naturally in a couple of years. So if you get an abnormal result, your doctor might ask you to get a repeat smear in a year, which gives your body enough time to clear it naturally if it isn't a cancer-causing strain. If it is, then you'll be referred to a specialist for further testing, and it's only if you leave this untreated that it can lead to cervical cancer. In all, well, not exactly all, 99.7% of cases of cervical cancer are caused by HPV, and there is currently a vaccine that protects women from some strains of the evil cancer-causing HPV, but not all of them. So just because you've had the vaccine doesn't mean you should skip the pap smear. Some common signs and symptoms of cervical cancer are bleeding when you're not having your period, weirdly long or heavy periods, more than usual tiredness, or lower back pain. If you are diagnosed with cervical cancer, surgery, radiotherapy, and/or chemotherapy might be needed. Smoking increases your chance of getting cervical cancer, as does persistently getting dangerous strains of HPV. Good news is, though, that in Australia, most early detected cervical cancers will be completely cured. In the end, it's important to know that no screening test is 100% accurate and correct, but pap smears are still really important. Since pap smears became a thing in Australia, people dying from cervical cancer have halved. The earlier the abnormality is caught, the higher the chance of treating it and killing that cancer. Are you due for a pap smear soon?